Welcome to Glidepath Behavioral Health. My name is Joseph Harrison. I'm the founder and president, and also its chief clinician. We are a value-based organization that uses a concierge model of care, bringing care to the patients who are suffering from adult and geriatric mental illness or dementia in their home, either through house calls or virtual visits. We collaborate very intensively with all stakeholders, including family, caregivers, facility staff, primary care providers, and our focus is on really optimizing both the behavioral health and the cognitive status of our patients. We also offer services to the loved ones and caregivers and family members of our patients as well. Glidepath Behavioral Health really exists because of my 10 years of experience as a nurse practitioner, seeing that the healthcare system is broken and does not properly serve older adults who are experiencing behavioral health illness or dementia. The way that primary care works in America is most primary care providers have up to 2,000 patients on their panel. And a very sizable proportion of those are older adults, and they have somewhere around 25 patient visits a day, sometimes 20, so they can maybe have 100 visits a week. Their schedule is very full. They have a lot of things to do. They have a full range of services, and so when older adults develop mental illness or dementia, and have clinical crises, which actually unfortunately often develops, the primary care provider is already really inundated with tasks and visits, and it finds it really difficult to accommodate the high-touch, intensive kind of care that patients like that need in those moments. What often ends up happening is there are very brief visits, too brief really, that prescription medications are deployed. But because this isn't the specialty of the primary care provider, and it's often an area that they're less comfortable with when it comes to medications, often not the best medicine is deployed, or the dosing is not appropriate, or the schedule of titrating up, raising the dose of the medication is not appropriate, or the follow-up time to assess the effect of the medication is not appropriate. And family members and caregivers and facility staff really find themselves in a non-medical person doing a lot of assessing and intervening without the support they need. And Glidepath basically fills that gap. And we really have a limit on how many patients can be on my panel or other providers' panels. We have myself and social work and psychotherapy and certified nursing assistants to really kind of address whatever may be the needs beyond just the dementia or the mental illness. Are there logistical needs? Are there caregiving needs? Are there connecting to existing resources that are available to the patient? Is there a need for advocacy with the primary care provider or the insurance plan? And we do that at the level and at the frequency and for the duration that is needed to improve the health and well-being or to alleviate suffering, if you want to think of it another way. In order to do that, and in order to be considerate of our patients' needs and the costs associated with care, we do bill Medicare for patients who are Medicare recipients. And then we charge a concierge enrollment fee and a monthly charge to actually help enable us to limit how many patients we follow so that we can fully be there for the ones that we do care for. I'm really looking forward to meeting you if you're interested in learning more, and it would be a pleasure and an honor to take care of your loved one or yourself. So we go and see patients in their home, myself and other providers in our team. We also use other technologies to help. We have a privacy, like HIPAA privacy law, a protected system of text messaging, telephone calls, emails, all within a firewall that protects the privacy of our patients and their loved ones. That can be used at any time, 24 hours a day, 7 days a week. We also have in-person visits and virtual care visits using that technology. We also have a lot of other means by which we can communicate virtually in real time and also what we call asynchronously with primary care providers and other stakeholders. And that is why the care becomes more effective, because of the intensiveness and because of how many resources we bring. Often when people think of psychiatry, they think of prescribing lots of medicines. And in adult mental health and in treating dementia, there are medications that become really helpful in helping to ease the suffering of patients and improve their overall well-being. But there's also got to be an emphasis on identifying medicines that may be causing side effects that do harm to the patient, interactions between different medicines, de-prescribing or discontinuing medicines that are no longer needed or no longer appropriate, and also thinking about addressing physical and behavioral health needs in a single prescription, not just one medicine for every single indication that the person has. And that is an area of expertise for me, and that I really am excited about trying to minimize the use of medicines and really focus on the appropriate use of medication for the patients that I serve. Let's talk about something other than medication for a minute. There's many different non-medication or non-pharmacological services that we bring to our patients. For patients who don't have dementia, we really heavily rely on skillful psychotherapy and counseling, and also something called psychoeducation, which is really teaching people about their mental health and how their mind works. For patients with dementia, we have a suite of different non-pharmacological treatments that we offer. They're only evidence-based treatments. We do not sell any products, and we do not recommend any specific products. We're talking about clinical treatments that are supported by scientific evidence. We also think about things like socialization, music, environment, exposure to the outside, sunlight exposure, things that actually have neuroscience and other scientific support to actually promote greater well-being. Of course, exercise and exercise training is another thing that we value a lot, and depending on the mobility and the chronic health conditions of the patient, we tailor those type of interventions to support optimal well-being for our patients. Well, I hope the information that you've learned in this brief video has been helpful to you. And if you have more questions or an interest in establishing care with Glidepath Behavioral Health, then you can reach us at our website, www.glidepathbh.com. You can sign up for an informational session there on our homepage, and then you can also email us if you prefer at help@glidepathbh.com, or you can call us at any of the contact numbers that you'll find on our website. And we look forward to talking to you more and seeing if we can do something to alleviate the suffering or help in improving the well-being of your loved one or yourself.